We've just finished some new analysis, and I think the new analysis has really struck me in terms of what it tells us about the value chain in terms of how we manage staff and what effect that has on service receivers, customers or patients. And this is data from the National Staff Survey of staff in the United Kingdom in the health service, 1.4 million of them, and we have surveyed them every year for the last 8 years. And what we've been able to do is to link the data from those surveys to data on patient satisfaction gathered from patients right across the United Kingdom, from all not just hospitals, but all healthcare organizations. And what we find is that staff views of their leaders is strongly related to patients' perceptions of quality of care. So when staff have positive views of their leaders, patients are much more positive about the care they receive. They say they are communicated with, they're treated with respect, they're treated with dignity, they're given privacy, and so on. Staff satisfaction and commitment directly predict patient satisfaction. There's a clear relationship between them. Supportiveness of the first line manager or one's immediate managers is also related to positive feelings, and that too predicts patient satisfaction. Remember, we're talking about 400 organizations, 1.3 million people, and these results are aggregated across, and the patient satisfaction surveys are conducted in every organization in the country. Poor staff well-being, work-related stress is associated with a low patient satisfaction, poor quality of care as determined by the regulators of our healthcare system, as well as poorer financial performance. And you can see that the best predictor that we found of patient mortality was the percentage of staff working in well-structured teams. And we can show that by increasing the number of, when healthcare organizations, hospitals increase the number of staff working in real teams, the mortality rate subsequently goes down. And this is controlling for other factors like organizational climate indicators and so on. Moreover, those working in well-structured teams are less stressed. And in fact, we find there are lower levels of violence against people working in well-functioning teams. 1 in 7 people in the United Kingdom Health Service is assaulted by a member of the public every year, physically assaulted. So it's a big issue. Where staff have opportunities to influence changes at work, then you have lower patient mortality. And I think it's because where we're listening to our frontline staff, where we're listening to what they have to say, then we're more likely to find out ways that we can improve the way we deliver services. It just makes sense because they are at the front line. Moreover, staff receiving well-structured appraisals is associated with lower patient mortality. And when there's a positive culture, generally we see low levels of mortality and they're declining. We find relationships with financial performance. Financial performance is in decline where staff see lots of errors, where they feel under pressure, and where there's little scope for learning and training. So, you know, the commitment that Avideo described of the bank to training of the staff makes sense in terms of the kind of findings that we're getting. So what we begin to see is an overall picture of good staff management is associated with the outcomes that we would want from service organizations. What's happening in practice is that we also see that absenteeism in the National Health Service in the United Kingdom is costing an enormous amount. 10.3 million working days lost every year. The average number of days taken by somebody working in the health service is 10.7, compared with the public sector of 6.4. It's a huge difference. So if we could reduce that difference, we could save a great deal of money. And as you know, the public services in the United Kingdom are currently under huge pressure. British Telecom and Royal Mail achieved 30 to 40% reductions over the last couple of years. And British Telecom is not the easiest organisation to manage, and Royal Mail has been probably the most unionised organisation in the United Kingdom, but still they managed to reduce absenteeism by 30 to 40%. And you can see the kind of financial figures that we're talking about here. Why do people take time off work? Well, presenteeism. People are attending work when they don't feel well because they don't want to let down patients and they don't want to let down their colleagues at work, and they get more ill and then they have to take a great deal of time off. 1 in 7 staff report being mobbed or bullied by their managers or their colleagues, and we know that that from Professor Zapp's work has a huge impact on their well-being and their physical health over time. And so if we could begin to address some of these issues, particularly for example the health and well-being of our staff, we could make great savings. You know, for me, one of the great ironies of the health service is that here is a service, an organisation that is seeking to deliver good health and good care for people, but is not actually caring for the health and well-being of those who are required to give the care. And those sorts of contradictions within organisational cultures, I think, are very powerful in undermining the effectiveness of organisations. The best predictor that we can find in our data of the overall performance of healthcare organisations is staff engagement. It predicts both individual outcomes like satisfaction and health and commitment, but it also predicts organisational outcomes like financial performance, mortality, and so on. And certainly what's emerging from studies in many countries is the importance of engaging staff, ensuring that they're engaged in the work that they do, motivated by the work that they do, and that they feel a sense of pride about their organizations, a sense of loyalty to their organizations, a sense of identity with the purpose of those organizations, of what they're trying to achieve. And for me, one of the really most pressing questions is how we can increase levels of employee engagement, not just because we want to, you know, sweat the assets of the organization and derive every bit of effort we can from the people who work within those organizations, but because we know that when staff and employees are engaged, they too benefit in terms of their quality of life. One of the key ways that we can promote employee engagement is very, very simple, but it is so profound that I think we overlook it. And if psychology has made an important contribution in the last 15 years to our understanding, it is a recognition that emotion plays an absolutely fundamental role in human experience. So we know, for example, that the level of positive emotion that people experience predicts longevity, predicts how long they live for. And the difference can be as much as 10 years between those who experience high levels of positivity and those who experience low levels of positivity. We know that you can predict a person's income at age 26 from the level of positive emotion at age 18. We know that if you induce positive emotion in a 3-year-old, they produce more creative paintings. And if you induce positive emotion in a 3-year-old, they're much more likely to behave cooperatively and altruistically with other children. We know that if you induce positive emotion in 83-year-olds, you see the same effects: creative thinking, cooperative and altruistic behavior. We know that you can predict relationship outcome from the ratio of positive and negative interactions between the partners in a relationship. We know that you can predict the financial performance of top management teams in the banking sector from the ratio of positive to negative interaction during meetings, about 5 to 1. So keep a count in the meetings and throw in a few extra positives if it's getting out of kilter. Negative emotion is really important in human behavior. We need to be angry, we need to be afraid at times to survive. But what the research evidence is suggesting is that there is an important ratio that we need to get right. And the absolute minimum seems to be about 3 to 1. We need to be having at least 3 positive experiences to every 1 experience. And if you want to explore this more, you can go to the website of Professor Barbara Fredrickson at the University of Michigan, which provides a lot more of the information about the research on all of this and allows you to assess your own levels of positive affectivity as well. You can also have too much of a good thing. And 11-to-1 seems to be where it starts to become aversive. I'm not quite sure why, but anyway, it is, you can have too much of a good thing. So, sorry?
He has that every Friday.
I said I have that every Friday.
Every Friday, too much of a good thing on a Friday, yeah, yeah. If we want to create engagement within our organizations, we have to create environments where people, by and large, feel positive. So we need to make sure that we're providing appreciation and recognition and support, and that people have fun. Rolf referred to my period working in the coal mines. Let's not romanticize working in a coal mine. They are horrible environments. But what made it so manageable was the wonderful humor and wit of the people who worked underground, and the fact that everybody took care of each other's safety first and foremost, that made it possible to work within such a hostile environment. Did you know, oh yes, I should say, I don't mean happiness. Do you know? For me, this is not about leaders being happy people. It's about us as leaders being real, being genuine in our behaviors, being open to people, situations, being curious, wanting to learn, wanting to understand, being kind to people, having an orientation of kindness, and being appreciative. So being real, being open, being curious, being kind, and being appreciative. Not some fake happiness that involves, you know, jumping on the table and clapping one's hands and clicking one's heels or whatever. Did you know that, well, let me share another result with you first before I go on and talk about relationships. When we did the manufacturing study, we interviewed the CEOs every 2 years for about 2 hours. And in a subsequent piece of research with colleagues at Rice University in Texas, we at random took 4 one-minute segments from those interviews. Do you understand? So at random, we took 4 one-minute segments from those tape-recorded interviews, and we counted the number of positive statements that the CEOs made. The number of positive statements predicted company climate as measured by employee opinion surveys a year later, which in turn predicted productivity. And the point of this is that we human beings catch emotions off each other far quicker and more easily than we would ever catch the cold virus or flu or whatever. We are acute to each other's emotions. We are so vigilant about each other's emotions, but we are particularly powerfully acute to the emotions of our leaders, wanting to see what their emotional state is. So how leaders behave is particularly powerful in influencing the emotional environment within an organization. So as leaders, we bear a particular responsibility in terms of our behaviors and the choices we make about how we behave and how we engage with people. You're more likely to die from loneliness than you are from the effects of smoking and obesity combined. You're more likely to die from loneliness than you are from the effects of smoking and obesity combined. If you're lonely and you smoke and you're overweight, you're in deep trouble. But relationships at work matter. And where you see chronic conflict within the workplace, where there are long-term conflicts between individuals, that damages those individuals and it damages the people around them. Now, transient conflicts are of course not a problem. My daughters have arguments at the dinner table many evenings of the week, and then 10 minutes later they're curled up on the couch with their arms around each other watching television. That's the nature of families and communities. It's when the conflicts are particularly intense, when they're particularly chronic, that they damage human health and well-being. And part of our responsibilities as leaders, I believe, is to intervene in conflicts within organizations that are becoming chronic and that are affecting the performance of the organization.